Good evening, ladies and gentlemen. Welcome to our Biodynamics AUA, Ask Us Anything. Today will be a presentation on B&B Dental from Italy, one of Malaysia's leading implant companies. So to begin today, we're going to introduce you guys to the company, explain a little bit about where B&B comes from, how it was initiated, and then we'll get into some of the technicals of B&B and their product range. So we're just going to show you a little video that actually introduces the company and B&B Dental. Okay, so guys, we've seen a little overview of B&B's implant system, some of the features that we're going to go into later. But to begin the story, let's go back to the founder of B&B Dental, Dr. Banzi, Claudio Banzi. And Claudio Banzi himself, a clinician from Bologna, was actually practicing implantology in the early 90s. And decided that he needed to create the most ideal implant to use on his patients, which is, the founding of B&B. So B&B Dental Sal is located in Bologna, city of Emilia-Romagna, which is obviously in the central part of Italy, north central. And B&B stemmed there and started in the early 90s with a very similar system to what you see in a lot of implants, the Brenner system. What you may not know is that where B&B originates from, the region is also known as the engineering capital of the world. So brands like Ferrari, Lamborghini, Maserati, Ducati motorcycles are all made in this region, just to name a few, as well as some of very famous engineering companies in other industries. So just to give you a bit of background about B&B's new developments, B&B has recently opened a new facility, a new building, for production, especially dedicated to the production of their new implant systems, as well as bone regeneration materials and other various implant components. One of the main features of this new facility is separation of clean rooms in order to be able to package both bone regeneration materials and implants, as well as their accessories. And not only is it any clean room, but it is a level 2B clean room, which is one of the leading industry standards for low bacterial charge. And this is just one of the many features of B&B's recent facility upgrades, once again, putting testament to the quality that they put out. In terms of production, I've personally visited their facility, and it really is world-class and very impressive. You'll see a number of Torin Deco CNC milling machines, which are Swiss-made. They have tolerances of less than 20 microns and tolerance checks of 1 micron every hour. They have 3 Datron milling machines, as they do a lot of prosthetic work in-house for their European market. And they have 2 full automation controlled systems, which do the inventory and stock management. So very advanced features in terms of production. A little bit about the product history, as I was talking about earlier with Dr. Claudio Banzi. In the early 90s, he created his first implant, the AC cylindrical, which was obviously an external hex system, very similar to the Brennermark. He then went with an AC conical in the sort of mid-90s, after developing, of course, bone regeneration material. So the NovoCore Plus, which was generated in the early 90s, is still being used today. It's a calcium-based formula, which actually comes from corals. And it has slow resorption properties, very good initial stability, very suitable for crestal sinus lift or large areas of bone regeneration. Later on in the late 90s, they invented the T-barrier collagen membrane, which is an equine-based collagen membrane, very large size pieces used for regeneration or to support bone regeneration. They also came out with the Duravit Mini in 2000, which are their range of mini implants. They started producing their own physio dispenser or implant motor in 2002. And of course, over the years, in the mid-2000s, they progressed to improve their line of implants with the 3P, EV, and wide system, also incorporating a slim. In the recent years, starting from 2014, B&B focused very heavily on guided surgery or digital planning of implant placements. They opened up their own in-house milling production system. And of course, in the last 2 years, we've seen the introduction of the pterygoidal implant and a new range of bovine bone regeneration materials. Okay. So again, B&B being a global company, it's available in more than 40 countries throughout network of distributors, worldwide certifications. So as you can see on the map here, B&B is all over the world, and as well as here in Malaysia, where we have medical device registration for all the products. Okay, so now I would like to introduce to you the fundamentals of the B&B implant line. So we'll start with the range of implants, the identifications, and some of the unique features that are present. So to begin, we have the full range from B&B, starting with, of course, the Duravit mini implant. As you can see, they have both a square head and conical head attachments for direct placement of prosthetics, or semi-removables or permanent removables. We have the Duravit Slim, which was designed to be used in the interior regions, and you'll notice that they come in 2 variations, which we'll go into with a little bit more detail later. We have the Duravit 3P, which, as you can see, has a very conical apex, very much designed for good primary stability in most normal implant cases. We have the Duravit Evolution, otherwise known as the EV, which, as you can see, has much more aggressive tapping threads and has a apical blade, and this would be used for increased primary stability in soft or more spongeous bone. We also have the Duravit wide implant, which is used for posterior cases where there is sufficient bone and initial primary stability is required. All implants basically utilize the same drill system, except for the wide implants. There are a few extra components. So of course the drills come in at 2.2 millimeter, 3, 3.5, 4, 4.5, and 5 millimeter diameter, correlating of course to the various implant sizes offered by B&B, starting with 3 millimeter all the way to 5, indicating the slim right up to the wide. All B&B implants, except for the slim implants, are actually packaged together with both a PEEK healing screw and a titanium cover screw. For those of you that are new to implantology, healing screws are utilized when the mucosal tissue preservation is desired to keep a mucosal profile, mucosal chimney. And cover screws are utilized in scenarios where regeneration of bone may be required, or due to the fact that there are no neighboring protections to protect the healing screw, a cover screw will be used, and a flap approach will be utilized. So both options are given to the implantologist on site, given that every implant includes both options as default. So here we can see an example of where a PEEK healing screw, and some of you may not be familiar with the material of PEEK. It is a biocompatible hybrid polymer, basically a fiber-based polymer. It's aesthetically colored. The color is aesthetically pleasing. The dimensions, of course, are designed according to standard healing abutments. And of course, due to the biocompatibility, we don't see any issues of patient compatibility. So the usage of a PEEK healing screw, as you can see in this profile, provides a very nice mucosal profile for the prosthetic stage. Alternatively, as most traditional methods use, of course, the titanium healing screw is used, and we suture over the implant site and allow for the healing for later removal and replacement with the prosthetic. Common features of the implant system. So these are some of the features that are inherent to all three of the major range in the Duravit, the 3P, the Evolution, and the Wide. The first, of course, is the platform switching. So again, for those of you that are very familiar with implants, many of you would have heard of bone level, tissue level, and platform switching. For those of you who are not, platform switching is essentially a design of the implant with an internal hex where the prosthetic interface with the implant provides a platform which helps to reduce bone loss. You achieve better representation of the biological width because of the profiling, and of course you have long-term aesthetic stability due to the ability of the soft keratinous tissue to develop. One of the features of this platform switch is, of course, compared to a regular switch, is the fact, as you can see in these two images, on the left we have platform switching, where you'll notice a gap and a platform visible. And in the regular platform, you'll notice that the abutment is flush to the connection of the implant, therefore not allowing a platform for the bone and mucosal tissue to bond. As we can see here in platform switching and non-platform switching, we see an inherent difference in the soft tissue management and the mucosal profile. So you'll notice that in the left image, the soft tissue goes right up to the inner edge of the implant, of the inner implant interface. And in a regular platform, there is actually a gap where the soft tissue has not reached the middle, therefore allowing for implantitis, other sorts of various bacteria to penetrate. Common features of the implant, again, is the Conexa connection, otherwise known as the Cono-Morse effect, which is essentially a special development in the design of the interface, which allows for a cold weld seal to be achieved. And in order to achieve this form of interface, there is a requirement for a perfection in the machining process, which allows the two surfaces to bond in a cold seal based on friction and the initial force put upon by the implant screw. And what is achieved in this effect is essentially a system where we have an indexing, okay? And this indexing provides the cold weld seal. And as we can see in this image here of a cross section, there is no gap between the abutment and the implant. And what this provides, as this lab report that was done in Germany on the Conexa system proves, is that there is absolutely no space for biological penetration, bacteria, and other undesired elements to affect the implant. This Morse taper system also provides a direct interface in the stability between the implant and abutment, relieving problems of stress to the screw, which in some cases results in screw loosening or perhaps even a fracturing of the screw or breakage of the screws, sometimes found in other connection systems that don't have this technology. And so this provides a much more reliable and long-term prosthetic restoration. Okay. One of the other features is the unique prosthetic connection. So basically between the three systems, we have an inherent connection system which is basically usable in all three, meaning that any of the prosthetics is interchangeable between any of the implant systems. So for example, we have we have polycarbonate glass abutments that can be casted. We have temporary PEEK abutments. We have titanium abutments, UCLA abutments, MUAs. All of them are interchangeable between the different lines of implants, meaning that the interface is the same. This helps to alleviate a lot of problems in terms of decisions on what type of abutments and implant systems, confusion between the various prosthetic options that are available. It simplifies and unifies everything under one prosthetic system. Okay, the final thing that we'd like to talk about in terms of the features of the implant is the extraction system. So going back to the Conexa connection or the Cono-Morse effect, basically when the two surfaces are friction welded together, what we call the cold weld, there is a lateral force required to separate the two components, meaning that even if you remove the implant screw, the abutment is actually still physically attached to the implant and not removable by hand. This provides reassurance, obviously, that if the screw was loose or in some way was fractured, that the abutment and implant would remain intact. In order to remove the abutment, there is a special screw, otherwise known as the extractor screw, which simply inserts into the implant, has threads that capture onto the abutment, and with a vertical force, basically separate the two components with minimal ease using a finger driver. Okay, so again, a very unique feature to B&B, providing that extra reassurance of the interface between the implant and abutment. Okay, so here we can see as an example, by removing the abutment, we can place the extractor screw, screw it in, remove it, and just unscrew the abutment from the extractor screw. Very simple. Okay, here we have a visual of exactly how that works. So simply put, as you can see, the threads are interfaced with the abutment and then provide an internal force as the screw continues down to be then pushed against the bottom of the internal implant interface and separate the two devices. Okay, so they also have the extractor screws. Now these screwdrivers are designed with the threads, so they can be utilized chair-side as an extractor in addition to a screwdriver. So they work as a dual function key. Okay, and as you can see, with the same effect, we basically screw in and it detaches the two components for easy removal. Okay, now I'd like to go a little bit more into the range of implants, so the key differences between the 3P, the EV, and the wide lines. So to begin, let's start with the 3P. As you can see, the 3P has a progressive tapered implant profile. It is very good for achieving primary stability in hard bone. It is precise on the drilling site preparation. You have better control during implant placement due to the profiling of the threads. And as mentioned before, it's suitable for D1, D2 densities of bone. As with all B&B implants, they are produced using titanium grade 4, which is the industry standard titanium for high quality implants. Okay, so again, please take note of the profile of the threads. One of the main features or differences of the 3P is the fact that you will notice that there's a micro grooving collar, and then you have an anatomical body. You have a self-tapering system towards the apex, and you have a conical apical tip, which is of course friendly to sinus lift procedures done in the Crestal sinus lift method. Also very safe to be used on implant sites where the sinus may be of concern. The thread profile is 60 degrees, and you will notice that there are generally 3 threads per turn. Okay. If we talk about the 3P technical files, here you can see all the various sizes available. So we're talking about lengths of 8 to 14 millimeters, and of course in diameters starting from 3 all the way up to 5. Okay, so these are the various sizes and variations that we have in implant. There is a 6.5 available, as we call a short implant, but later on we'll get to that as it requires a special screw. Okay, so here you go again, the implant diameters starting at 3.5 all the way up to 5, and length starting at 6.5 and all the way up to 14. As mentioned before, with the shorter implants, there is a special prosthetic screw that is actually included with the implant and is to be retained and only used in replacement of a regular prosthetic screw during the placement of the prosthetic. The reason for the special screw, which you can see is colored blue-purple, is due to the fact that the implant internals are much shorter, and so the screw length is actually different. Now we come on to the EV implant. Now you'll notice there is a drastic difference in the thread profile of this particular design. Most notably, there are only two threads per turn. This particular implant is superior in primary stability and ideally used in spongeous bone, D3, D4. And what it does is it condenses the spongeous bone and provides the ideal primary stability required in soft bone situations. It's also very ideal for post-extraction conditions. So for example, immediate placement of an implant into a post-extraction socket. It is very suitable for immediate loading due to its immediate primary stability. And of course, it has a smaller diameter preparation zone due to the fact that it has the apical blades, which obviously self-tap into the bone. Again, it's made with titanium grade 4. The features are very similar to the 3P. There is you don't see the micro grooving, but we have what we call the back tapered conical design with micro rings. We still maintain the Morse taper and internal hex. You will see that there is a double threaded body versus a triple threaded body, self-tapping system as we saw in the EV, but the difference here being there is also an apical blade, which means that it is designed to help achieve that primary stability. Now, this implant wouldn't be suitable to be used in a sinus lift situation, or if there was an area that was concerned to do with the sinus. Again, we can see the technical profiles. There is a much wider angle between the blades. The blades are dimensionally wider, and of course the spacing between the conical blades is actually more sparse. Here we can see the various sizes available in EV, again starting from diameter of 6.5, in length 6.5, diameter 4, all the way to 5, and in lengths up to 16. Now we come to the wide implant. The wide implant shares some characteristics of both the implants. So we will notice that it does have a sort of conical apex. However, the thread profiles are closer together, and we will also notice that there is no micro grooving at the top. This still maintains the Morse taper and internal hex. The body design follows the EV with 3 threads per turn. We can see a self-tapping system is still present, and the apical is again like the 3P bone friendly. Okay, here we can see the technical profile of the wide implant, and again we can see the sizes available from a length of 6.5 to 14 and diameter 5.5 to 7. What you'll see here is we have what we call the wide surgical kit. So this particular extension of the surgical kit is specifically designed for the wide implants to provide the correct diameters in order to prep the site. Now we come to the slimline. So the slimline was one of B&B's more recent developments in the timeline of their implant development of various different designs. And the slim implant was designed for use in the anterior region, primarily in the aesthetic zone. So again, they come in both the EV and the 3P, and you will notice that the designs are very similar to their cousins, the 3P and the EV. However, the slim implants have some characteristics of their own. So starting with a 3.4 millimeter, we have a double sharp threaded body, very similar to the EV. We have a bone tapping properties, and you will also see that we still have the apical blade, again used for the initial primary stability in soft bone. Okay, so very similar features. We still have the black tapered conical. Now you will see that we have a conical connection, but we do not have a Morse taper. So the slim implants don't retain the same Conexa design as what's found in the EV 3P and the wide implant. However, other characteristics are still maintained. You will notice that the profiling is very similar to the EV. Then we have the 3 millimeter. Now the body of the implant is still the same as the slim 3.4. However, due to the narrowness of the threads following the 3P design, we have a slightly different approach. So again, this implant is very suitable for hard bone or where the primary stability is quite easy to achieve. It has progressive tapered threads. Again, you will see three threads per turn. And of course, again, it's designed for all types of bone, but more primarily for hard types of bone. Once again, we see the features very similar to that of the 3.4 slim. We do not retain the Conexa system, but we do have the conical connection or internal hex. Micro grooving collars are present on this implant. And of course, you'll see that it has self-tapping, but has an apical blade, meaning that it has basically a conical tip. Dimensions of the implant very much the same to the other slim implant, other than the thread profiling being different. Thread dimensions are slightly different. We can see here that the abutment interfaces between both the slim implants are very much the same as the 3P, EV, and wide, meaning that the abutments of all the different varieties are all interchangeable between the 3 and 3.4 of the slimline. Here we can see a case example of where the slimline implant has been used in the anterior region, very small dimension, very small vertical dimension, and of course you can see the final restoration fits perfectly. So now I would like to introduce you to the surface preparation. This is obviously a topic that's always in hot discussion amongst a lot of implant users. Techniques that are used, different techniques used for surface preparation, different post-processings of surface treatment, and talks about biologically active surfaces and so on. So B&B over the years has drastically evolved its surface preparation techniques, starting out with sandblasting and double acid etching. They evolved that to mechanical blasting and acid etching, and today we'd like to talk to you about their latest technique, which of course requires maintains two benefits. The first being biologically clean and of course a uniform surface, while still maintaining the size and shape of the spires or the threads on the implant. This is critical. So just going a little bit deeper, we can see here the preparation of a B&B implant. So you can see the surface porosity between 2 and 10 microns. And this is due to the microblasting that's conducted on the implants. And as you can see, this produces a very rough, very porous, and very biologically active surface. Okay, so we can see at 2 microns and down 10 microns, we can see the difference. One of the new additions to B&B implants is the introduction of argon bombing treatment. Argon bombing treatment consists of bombarding the surface with argon gas, which is free from any contaminants. And what it does is essentially cleans the surface and activates the metal surface by exciting its atoms and making it more receptive to biological interaction. This particular technique that's been introduced basically allows the implant surface to also become wettable. And we'll explain a little bit more in the next slide. The wettability of the implant highly increases its moisture absorption. And in regards to the implants, here we're referring to the absorption of blood or stem cells in blood in order to do regeneration. So here we can see the new argon treatment and what it actually does. So as we could see in this video, basically what had actually happened was the argon blasting treatment has basically decontaminated the surface of any processing residues. Now again, I've visited the facility and seen how these implants are produced, and what we don't see in the production side is that these implants are produced under a milling process that exposes them to oils that are used in cooling process during the machining. And a lot of these contaminants are very difficult to remove from the implant surface. And so what we find with a lot of inferior designs or inferior techniques of surface preparation is that it's almost a hydrophobic effect on the implant that doesn't allow the breaking in this video of the surface tension of the water, and therefore not really allowing moisture to penetrate the inner surface or below the surface of the implant, therefore promoting the biological acceptance. In this case, we're talking about the healing process, which is obviously accelerated by attracting blood into the implant, and that blood is rich in hemopoietic stem cells. Okay, so again, this is another technique or another effort from B&B to increase the biological acceptance of the implant to provide a really superior surface finish, and to be of, one of the leaders in this field. So here we can see that some of the surface features in a histological section, which showed 30% of bone after 30 days. So these images, to summarize, is basically showing you the osseointegration or the bone development that develops around the microgrooves of the implant after 30 days. And as you can see, there's a very homogeneous interaction, and there is no signs of resorption or rejection of the bone from the implant surface. Okay, so now we've seen the implants. I would like to go over a little bit of the surgical kits and introduce you to some of the tools that are used in the entire line of B&B and the simplicity that B&B has focused on in order to streamline their implant systems. So of course we see here one simple complete surgical kit can service both the Duravit Slim, the Duravit 3P and Evolution system. What that means is that within one single kit, we have the bone drills, we have the expanders, which we can use to compact the bone, or we can call them compactors. We have the indication pins that we can use to check our angulation if we're doing a manual surgical protocol. We have all the implant drivers. You have two variations of implant screws. You have the contra-angle driver. You have the slim implant driver. You have the slim implant screwdriver. You have stoppers. Stoppers are used to control the depth of a manual implant procedure without having to actually visually view the measurements on the drill itself. You have a manual wrench, and of course you have a key wrench driver, which is used primarily for stability in placing regular slim implants in the aesthetic zone, okay, with very good control from the palm. We also have, as you can see here, a breakdown of all the components in the drill. So as you can see, it's very, very complete surgical kit. Again, stressing on the fact that we have parallel pins, countersink drills in case we have a very narrow or very hard cortical bone. We have torque ratchet mounters for the slim and the regular implants in both long and short. And we have the prosthetic screwdrivers. We have extenders. So you have everything that you need chairside to perform any kind of procedure that would normally be encountered in a manual implant procedure without having to request or fumble for another kit, okay, making it very convenient. Here we can see, as mentioned before, the wide implant surgical kit. So this is a standalone kit that can go in addition to the complete kit. And its primary purpose, again, it includes all the drills as well as the stoppers, the screwdriver and the implant drivers, but dedicated to the wide line of implants, okay, because they have a much wider diameter than the standards. Here we can see the basic prosthetic kit. Again, a lot of prosthetic components are found in the surgical kit, so the same kit could be used for both procedures. But assuming that you had intervals of surgeries and you work between patients, we do have a prosthetic kit, which is available, and that contains the equated driver. We have the flat driver, we have MUA drivers, we have extractors and screwdrivers, so everything that could be required. In addition to that, on a separate component, we have the guided surgical kit. So again, as I mentioned, B&B in 2014 put a really strong focus on developing digital implantology within their company. They developed softwares which they could use, and again, we'll do this in another stream where we'll talk more about guided surgery. But they put a heavily strong focus on guided surgery, and it's evident in their guided surgical kit, as you can see here. So this kit is dedicated for guided surgery. It is one complete kit that contains absolutely everything that you could possibly need in a guided surgical scenario. We have, again, guided compactors to compact soft bone in order to get primary stability. You have both a manual and a torque ratchet. You have lance drills, you have extractor keys, you have converters which are designed to convert various diameters, so between the 4.4 and 4.5 and 5. We have all the prosthetic screwdrivers, you have all the drills, you have countersink drills, again for widening your cortical bone. We have the lateral pins used to secure the surgical guide to the upper mandible. And we also have all the compactors and expanders. We have Cresto screws to hold everything that is required. You'll notice that there are also mounters. Mounters are designed to actually mount the implant in place when you're doing multiple units in guided surgery. So again, this is another complete kit from B&B, so that if you were to perform a guided surgical protocol, there would be no need for multiple kits or multiple sets of drills in order to achieve or complete that surgical procedure. Okay, very comprehensive. All tools are made to the highest standards. They're all produced in Germany. They are produced to the highest standards of dental tooling. And so you can be reassured that all the tools and the surgical kit casing itself, which is autoclavable, will basically perform as expected from any substantial implant brand. Now I'd like to go on a little bit more onto the regenerative materials from B&B Dental. So as mentioned before, initially their regenerative materials were focused primarily on the Novacol, which we see here on the right. Novacol Plus is an argonite calcium carbonate. It is based on the same structure that corals are made from. And the idea behind it is that calcium carbonate breaks down very, very slowly. It is a very good material for primary stability, again in large areas of bone reconstruction, very suitable to hold up a sinus floor in a what we call a crestal sinus lift procedure, and a number of various other surgical procedures. However, due to the slow resorption rate, it is not necessarily ideal for all kinds of procedures. For example, filling a socket that may be required for a later placement of implant, and so on. So as a substitute, B&B in 2019 has launched the NovaBone Putty and the NovaBone Granules. And basically both these regenerative materials are made of bovine-based materials, meaning that they are of a cattle or cow origin. They're one of the most suitable in terms of integration with humans. And because it comes in two different forms, you have both the granulars and the putty. So again, just to highlight on Novacol Plus, which again has its own purposes and ideal situations of usage, we have natural coral grafting material. It's 100% mineral based, very slow resorption with direct integration of new bone, safe and sterile, easy handling, and a long resorption time suitable for certain scenarios where we have large areas of regeneration. We don't want the bone to resorb too quickly. Okay. Then we have the NovaBone granules, which come in various different sizes from 0.5 grams up to 5 grams, and the granule sizes are between 0.2 and 0.6, which is quite an industry standard. Of course, the material can be applied from a jerry pot. It's your standard procedure. It can be used in GBR. It has long-term dimensional stability, but the resorption rate is cut by half to about 4 to 6 months, again with easy handling. What we also introduce is the NovaBone Putty, and as the name describes, it is a syringe form of NovaBone, again in the granule size of 0.2, 0.6, and in sizes of 0.5 gram and 1 gram. And it's designed for the easy and steady placement in small sort of regeneration areas, mainly for the convenience of the practitioner. Okay. Within their regenerative materials, again reinforcing some of the products that they had before, we can see here the T-barrier collagen membrane made from equine material. For those of you not aware, equine is horse. So it comes from an equine background, and the reason for using equine is because equine is one of the other compatible biological materials with humans that does not carry any diseases, and therefore very, very suitable for use in human surgeries. The size of the membranes are much larger than those found from other various manufacturers, and therefore can be sized down quite conveniently for small surgeries or used in larger pieces for bigger reconstructive areas. What you'll see on the right, we have the T-barrier membrane titanium, which is a titanium-based mesh, which again we use in conjunction with the T-barrier membrane or as a standalone mesh, to retain large areas of reconstructive bone and to stop the material from dislodging or displacing itself. Very useful again for large areas of reconstruction. So some of the properties: it's perfectly biocompatible. You see resorption within 6 to 8 weeks. The characteristics of this membrane is, of course, once it's wetted with the patient's blood, it becomes almost like a gelatin type application. Can be applied over a bone regeneration area could also be used as a buffer between your regeneration bone that you inject into a crestal sinus lift, just to provide a sort of protective layer between the sinus floor and the new granules that you're injecting to raise the sinus floor. Okay, so a very versatile material. In conjunction with the titanium membrane, of course, there are the titanium screws, or what we call osseo screws, which can be used to secure the titanium mesh, which of course can be bent, cut, and shaped to a regeneration area, and the screws can be used to retain that mesh and to hold that regeneration area until a later time when it can be removed once the resorption has taken place. Okay, so that concludes all the regeneration materials. We'd now like to move on a little bit to highlight some of the stuff that we as biodynamics, Bio3D, Orthotech, what we've been doing in terms of education on B&B implants here in Malaysia. B&B implants has been here in Malaysia since 2016, 2017. And since then, we've obviously done a lot of work in terms of workshops, educational platforms, online courses, events, and live surgeries and hands-on workshops. Okay, so one of the things that we have dedicated is we have a dedicated training center, BioLearn, in Sri Kembangan, Kuala Lumpur. And this training center can host, easily 30 to 50 participants. Obviously now with the MCO, CMCO, we have some regulations, so we can comfortably accommodate 15 to 30 people with the requirements. And of course, prior to the restrictions, we would quite often bring in speakers from all over the world to partake in events, lectures, hands-on workshops, and even live surgeries. So some of the events that we've conducted across the globe as B&B, and as you can see, some of those were hosted here in Malaysia, like the one we did last year with NASA Italia and 3Shape. And you can see that we've done quite a number of hands-on courses where we have had doctors from overseas come over here to Malaysia, and some local doctors as well, performing live surgeries on patients with demonstrations to participants. Okay. We've also conducted a handful of hands-on courses where we do simulations on models, on mannequin dummies of patients for various procedures such as crestal sinus lift approach, basic implant placement, and guided surgical procedures. And of course, B&B conducts international lectures all over the world and hosts events all the time. Recently, of course, a lot of those have been put online due to the restrictions of traveling, and those are constantly ongoing. So, of course, last year, B&B had a very big international gathering, Symposium of Forms, meeting of 2019, which was quite a special event. It was hosted in the Lamborghini factory. And of course, doctors, dealers, and people involved with B&B came from all over the world to celebrate that event. Thankfully, it was before the virus, and so a very successful event. These events will go on annually, and we hope that as things start to ease up, people will be able to travel, and we'd be very happy to have Malaysian doctors attend these international events, not only to gain insight, but to gain some exposure. And of course, on a finishing note is just to also put in touch that B&B obviously are affiliated to quite a number of universities in Italy as part of their ongoing research and development and conduction of their case studies, and obviously development of new techniques such as that we saw with the argon blasting. And so just to name a few, some of the universities that they are involved with is the University of Roma, the University of Milan, the University of Venice, and they conduct a multitude of various cases with professors from all these universities. And as you tune into some of B&B's live performances or live streams that they'll do with courses, you will get to observe a number of these professors explaining certain techniques. For us with the AUA, as we progress further in our series, we would also like to bring you more information on some of these unique features such as guided surgery, pterygoidal implant procedures, subperiosteum implants, And so we hope that you will join us again in the future as we bring more and more information to the platform. And we thank you again for your support and your time. So thank you again, guys, for tuning in. For those of you that may not have been able to make it, there will be a re-record available at some point. And so you'll be able to catch up on all the information. Before we summarize, we've received a number of questions from some of our users, some practitioners, and from people in inquiries as to some of the questions that they have in regards to B&B, which I would like to answer before we leave you guys. And the first of these questions is B&B digitally enabled? So as I did mention before, B&B put a heavy focus on the ability of guided digital planning of their implant systems. And a large portion of that was basically ensuring that their system was made available to a number of softwares that are involved in digital planning of implants, such as ExoCAD, 3Shape, 3D Dime, just to name a few. And so they are available as a planning system on a lot of commercially available implant planning softwares. However, B&B also developed their own software, which is available to its users in order to help them plan guided implant cases. B&B's facility in Italy for their European users also has the ability to receive digital cases for prosthetic planning. And so to answer that question, yes, B&B is fully digitally enabled. Okay. Another question we have here from a different user was, how does B&B Dental implants fare with peri-implantitis, and what is its features? Okay, most unique feature in its system. So as I explained earlier, basically peri-implantitis is not really an issue so much for B&B implants, especially the 3P, EV, and wide implant system, due to the Morse tapered cold weld connection, or the Conexa system. Basically, because there is no possibility of post-procedure penetration or post-prosthetic procedure penetration of bacteria, so long as there is sufficient or adequate cleaning of the implant prior to the placement of the final prosthetic abutment, and that the connection is properly established, meaning that the implant is placed correctly, the abutment is placed correctly, and the screw is tightened to the correct torque, yes, the chances or the likeliness of peri-implantitis is almost non-existent due to the lack of leaching of toxic bacteria. Okay, so hopefully that answers that question. The next question we have here is, who can produce the prosthetics for B&B implants? Are all the lab analogs available for prosthetic production? Okay, so I assume that we're referring to here in Malaysia. Yes, here in Malaysia, Orthotech is the main lab that can do the prosthetics for B&B. However, given just like any other implant system, any lab should be able to produce the prosthetic for the implant. And the prosthetic system, if you're referring to the abutments and all the range of analogs, yeah, they are all completely available to the labs through Orthotech and Biodynamics. And yes, the prosthetics can be produced by any lab. Okay. The next question I have, I'm interested in guided surgery. I do not have the use of a third-party software. Do I have to have the use of a third-party software? Okay, so this comes back to the previous question I was answering. So B&B is integrated into softwares such as 3Shape, ExoCAD, and a number of other planning softwares, iCAD, etc. But of course, B&B does provide its own implant planning software, which is basically free for B&B users to use. Then there is a small nominal fee, obviously, for exporting the guide and for the production of the guide, depending on the lab you use. But yes, there is an option which does not require third-party software. The next question I have is, are there white papers or valid studies on B&B implant systems? Yes, there is. As I mentioned towards the end, on the same page as we can see here, there is actually a number of white papers, and B&B constantly is in collaboration with a number of very famous large universities in Italy. and some third party in other countries where they constantly conduct research. They do a lot of case studies. And of course, if you were to inquire either with B&B or ourselves, we'd be more than happy to share those documents with you on the research of some of these techniques or particular surgical protocols. Let me see, do we have any other questions? A question here, B&B mini implants, do they go through the same surface treatment? Yes, all B&B implants are actually produced using the same grade of titanium, and all the implants undergo the same stringent procedures for post-preparation, packaging, and obviously distribution. So to answer the question, yes, they do. I think that wraps up all the questions for today. Again, if any of you guys do have any questions, please do shoot them our way. We'll be more than happy to answer them even after this. And again, thank you for joining us. We hope to see you in the near future. Thanks again.